Hey, I'm Dr. Joe Niamtu, LoveThatFace.com. I'm a cosmetic facial surgeon in Richmond, Virginia. I'm double boarded. I do surgery from here to here. I don't do boobs, bellies, and butts. I'm a facial surgeon. Today I want to talk about a common situation, and I probably have some older videos about that, but it's always good to talk currently about things. Excuse me. And one of the things that I see are patients come in. It could be a male patient or a female patient, although it's more commonly female, and they come in for a consultation for deep plane face and neck lift, and they say, my husband is very resistant for me doing this. He doesn't want me to do this. And, you know, it can be the other way around. It can be a man that's having surgery, and the wife may say that, but much more common when it's a female. So let's talk about this for a second. Why would a husband not want his wife to have cosmetic surgery? Okay, well, there are a myriad of reasons, but things that I think have to do with the dynamic. Sometimes maybe the husband just, doesn't want that expense. Could be part of it. I think sometimes if your mate or your spouse is having cosmetic surgery, maybe sometimes there's a little bit worry that they're going to look better or prettier or more handsome if it's the other way around, and maybe draw attention, unwanted attention, that people are going to pay attention to them because they look younger. There's just a lot of issues, but one, and this is really kind of a touching issue, is they frequently will say, "I love you just the way you are," and that should be a song. No, it is a song. And you know, when somebody says that, well, what they're telling them is, you don't have to do this for me. I love you, and I don't think you need it. So, and that's coming from the heart, and that's not anything that has to do with an insecurity or anything like that. So, what do you do about it? Okay, well, I've seen cases, and again, I've done almost 1,800 facelifts over 3 decades here, so you kind of see it all. And I've seen cases where husband is resistant and the wife has surgery, and maybe you have a little setback or a minor complication, and it's like, I told you you shouldn't have done that, you should have listened to me, and it all heals and everything gets better. And I've seen situations, again, on both sides, husband or wife, where after they go through the surgery and heal and they look better, then it just kind of calms things down, and it's like, yeah, okay, I'm glad that you did that. One thing that is important, though, with family dynamics is you don't want it to be such a contentious issue that it's going to rock a marriage or a relationship. And so sometimes you have to, kind of talk it out with both parties present. And I think another reason, I should have mentioned this earlier, is maybe the husband or the wife is afraid that their spouse is going to look crazy, like you see a lot of poor cosmetic surgery, and reassuring them that they're not going to do that. I tell the patient, look, it's your face, it's my reputation. If you look bad, I look bad. And I kind of lay them back in the chair and have them lift their chin up and show them what they would look like with a facelift. And that kind of relaxes a lot of the tension sometimes, because it is a scary situation. And if it's really, really bad and there's a lot of argument and a lot of resistance, and if you do this, I'm not going to be your caregiver, then I don't want to do the surgery. Okay, at least until the family can sort this out. I mean, sometimes they may need to see a counselor about it, but it's for healing, you want a perfect, relaxed situation. You want a compassionate caregiver who's going to help you. You really don't need somebody, arguing with you when you're trying to heal. So I hope this makes sense. We have a lot of ragweed in Richmond, Virginia right now, so excuse my voice. I'm allergic to it. But hope this makes sense. And I think all surgeons will see this from time to time, and some patients will experience this. I'm Dr. Joe Niamtu, LoveThatFace.com.